And now we welcome a special guest to the stream. Secretary Doug Collins from the Department of Veterans Affairs joins us now. Secretary Collins, we appreciate you taking a little bit of time with us here today. We want to start with some changes that the VA has made, some improvements that the VA has made for veterans. What are some of those improvements that the department has been working on and implementing?
Well, I think that the biggest thing, Connor, is looking at putting the veteran needs first. And that's saying, how do we make whole existence here at the VA is about the veteran who walks through our front door or calls or asks about the benefits that they've earned. Aside from them, we don't have a job. So it's logical that we put their needs first and we assess everything through that lens. And how that's actually looked at the last year and a half is we actually have had dropped our backlog from 260,000 down to under 75,000. Those were 125 days old. We're getting faster completion rates so that they can get their answers, and the quality has gone up, and the percentage of appeals has basically stayed the same, even with a much larger processing of claims. So we know that they're getting the best decisions possible. We also have opened up more appointment times across the country. Over 2 million plus hours have been opened up across the country for veterans so that they can get the health care that they need at the time that they need it. We've also expanded our community care footprint, making sure that they have the ability to access doctors in the community, not just at the hospitals. And one of the things, and especially for your area down in Norfolk, we've opened up new clinics around the country. We opened up 35 just in the last year and a half. We have more coming in that have brought the care closer to the community of veterans that we have. So a lot of different things going on, and a lot of things continuing that I think are going to meet the healthcare needs and meet the benefits needs of our veterans.
I want to stay on the doctors in the community that you mentioned there. What's the process for
Yes.
finding doctors in the community that you can trust, that you can utilize as a resource, and that your veterans can do the same?
Well, one, we value all our healthcare community. We're the largest integrated healthcare system, but we also are in partnership with many of our local hospitals and community hospitals that treat everybody in the community. And what we do is that when there's a certain processes from drive times to actual wait times at a facility, but also there's best medical interest where the doctor can sit down with the veteran and their caregiver and decide, hey, is it easier for me, especially an aging veteran who doesn't want to drive as much, and it's in their best interest to say go to to get their eye care closer to their home instead of having to drive maybe 30 or 40 miles. That's a way that they can then get that care quicker. It's still VA care. We're still paying for it, but we're making sure that the quality is there, but we're making sure that the veteran is able to use the benefits that they have.
And then, it sounds like you guys are doing so many good things, making so many improvements. There's always challenges to come, we know. What are some major challenges that you guys are looking to tackle heading into 2026?
I think overcoming the past, and I say that with respect, but I think what we've had to overcome is a VA system that was more focused on itself than it was the veteran, and that's left some lingering problems. Everybody can tell you the bad story about the VA. Well, I'm here to tell you that look, we're going to do some things that have made to improve, and that, yes, will some people have still an experience that's not what it should be? Yeah, probably so. Just like every other hospital in your listening area right now has the same issues. We're trying to make it better, though. That's the big difference right now is we're moving forward and saying, here, where can we actually work to get the veterans the best help, the best treatment they need, and make it easier and faster and more accurate for them to get that. So I think the biggest thing is to overcome is just overcoming what we have faced in the past and making sure people understand what we have done that is affecting our veterans.
And when it comes to care for veterans here in 2026, how is it different in 2026 than maybe it was in 16 or '06 or even the previous millennium?
I think it's just a matter of how we get healthcare delivery. Think about it. And no matter where you get, everybody has healthcare delivery in some ways. I think we're now much more automated. People are much more adept to getting records on their phone. They're making appointments on their phone. We're updating our electronic health records management system to reflect those newness in new things, which some of it, frankly, is not all that new anymore, so that our veterans have the same quality of care to say that they would in a public or private hospital outside the VA system. We're also taking things like telehealth. We're actually making more use of remote doctors, especially for our rural areas and others, so that they can have access to quicker care instead of having to go somewhere. They can actually use it right there in their homes as we go forward. We're doing a lot of things that make it easier for the veterans to get the health care they needed. So I think those are the things that make it a look ahead that I think is going to be very good.
Last question for me, for veterans who are watching and they're saying, this is a VA that I really want to be a part of and that I want to utilize, how can they reach out? What's the best place for veterans who maybe haven't been involved to now go and use some of these resources, get the help they need?
Well, I think it's a great question. For those new veterans coming out, get it done quickly. Start off quickly. Go ahead and make your make your initial claims. Get that done and started. For those who maybe have had you're in the system, or even if you had a system, you've waited for years and never thought about it, go to va.gov. va.gov gets you every bit of information you need to how to start claims, how to find health care to do the things that you need. Or if you want to talk to somebody, you can always call 800-MY-VA 411.